a powerful group.
Mm-hmm.
It should be live. Are we, Leah?
Are we live?
I believe we are.
Wonderful.
I
Good
can't
evening,
believe-
everyone. Welcome to the second of two community discussions that are inspired by Open Call for Clemency, which is an online exhibition organized by the Confined Arts and the Release Aging People in Prison campaign. The exhibition is curated by Claire Kim. So we have gathered today because of a pressing issue that many of us are already acutely aware of, but the current COVID-19 pandemic poses an imminent risk of serious illness or death for people who are incarcerated or working in correctional facilities across the nation. According to data gathered by the Legal Aid Society, the infection rate at local jails is more than 7 times higher than the rate citywide, and 87 times higher than the country at large. An epidemiological model released by the ACLU and academic research partners found that there will be nearly 100,000 more deaths than current estimates due to the failures to reduce jails. Open Call for Clemency, an online exhibition, urges governors to release those individuals who are most vulnerable during the growing and already deadly outbreak of COVID-19 among people who are currently incarcerated. So the exhibition was curated and produced by the Confined Arts and the Release Aging People in Prison campaign. Today we have the honor and privilege of speaking with the leaders of these organizations who will both tell you a little bit more about their work. But as one of the leaders is moderating, the leader of the Confined Arts is moderating this panel, I'll give you just a brief overview of the Confined Arts, and then we'll allow Jose Saldana to speak more about RAPP, the Release Aging People in Prison campaign. So the Confined Arts is a community-led arts and advocacy program at the Center for Justice at Columbia University and the Center for Institutional and Social Change at Columbia Law School. The program cultivates and showcases the talents and creative voices of artists directly impacted by mass incarceration and intersecting social justice issues. Through artistry, collaborative activism, research, education, and training, the Confined Arts equips artists to influence policy change and use their artistry and knowledge to advocate for a world anchored in empathy and saturated with healing and prevention-based policies. So this collaboration has resulted in Open Call for Clemency. Here we're seeing a piece of artwork created by Kenneth Reams, who will be on the panel today. Open Call for Clemency as an exhibition features work by artists who are currently incarcerated. The work reflects on the personal responses to the COVID-19 pandemic with a focus on the urgency and importance of clemency. The goal of the exhibition is to emphasize the humanity of those who are incarcerated, share their works as widely as possible, and ultimately reach governors' offices to advocate for clemency and commutation of sentences. So a brief introduction to the content of today's discussion, which is clemency, reentry, and community concern, exploring possibilities for true public health and safety for all people. So the meaning of public safety and public health are being redefined in the midst of a national movement against racial oppression, which is situated against the backdrop of the pandemic. Just as the movement for Black lives and its predecessors who have fought for racial equity for centuries call for liberty and justice for all, we too must consider how we will achieve health and safety for all people, including those who are incarcerated. So since the COVID-19 outbreak took hold of the United States, activists, medical officials, and state representatives have called attention to the difficulty of complying with health recommendations to prevent the spread of the virus within jails and prisons. Last week, the New York Times reported that the 5 largest known clusters of the virus in the United States are inside correctional institutions. Many have advocated for decarceration as a means of protection, health, and safety for those who are incarcerated. Yet conversations of what is sometimes referred to as early release will dive further into what that concept actually means today. Those are often linked to and countered by expressions of concern about a very narrow definition of public safety that assumes that people who are incarcerated present a risk to safety of society upon reentry. In order to address this, we must grapple with complicated questions, such as at what point does a person cease to be what we consider a risk to public safety, invoking community concern? And when are people who are incarcerated considered no longer a risk to public safety? Are they considered a risk for the remainder of their lives? Again, something else that we'll break down today. Throughout today, we'll be specifically focusing on the possibilities for achieving true public health and true public safety for all people by listening to and addressing some of the community concerns that have prevented wide-scale decarceration efforts. So without further ado, I'm going to turn it over to Pastor Isaac Scott, the founder and director of the Confined Arts, who will be moderating today's panel to introduce our panelists.
Thank you very much, Leah. Thank you very, very much. I appreciate you so much for that beautiful introduction. Welcome everyone to Open Call for Clemency. This is our second panel discussion coming out of this exhibition, and we are very, very happy and very joyed for this conversation in particular because we get to really dig deeper into some of the meat, and a lot of the meat to which we are looking to dig in to get to the bottom of what's going on and why folks are not coming home. Why do we have to bang down doors? What's going on? What's the concern? Why can't we get our brothers, our sisters, our aunts, our uncles, our mothers and fathers home during this time? How come they can't be protected during this time? So we'll be dealing with a lot of that this evening. I have an amazing group of people here. And I'm super excited about it. I'm just super excited about opportunities to be able to build with everybody. And I'm just very interested in just hearing and learning from everyone. But I won't take too much longer because we got a conversation to get to. Jose, first what I'm gonna do, forgive me everyone, I'm gonna introduce our panelists in full. Let me do that. And then we'll get into the conversation. But Jose, I'm gonna spring the first question on to you after I do this introduction. So I want to first introduce Jose Hamza Salanda. He is the director of the Release and Aging People in Prison campaign. I want to also introduce Rosalind Smith, who is an activist organizer with RAPP, and she is also a part of the, I want to get this right, forgive me, because this was a title we didn't initially have for her. And I want to make sure I have this right. Rosalind is with Beyond Incarceration Program Manager of VDAY. And I wanted to make sure that I touched that specifically because when you learn more about that work, you'll understand the importance of it and the importance of it being mentioned right now. So also I want to introduce Elder Qualls, who is a reentry specialist who's joining us from Michigan. I also want to welcome Jason Wu, who's a community board 11 member with me. He's also trustee of the Association of the Legal Aid Attorneys, UAW 2325. I also want to introduce David Harris, Managing Director of the Charles Hamilton Houston Institute for Race and Justice at Harvard University. In that same token, I want to introduce Jindu Obufuoma, Legal Fellow in Criminal Justice Policy Program, Harvard Law School. And finally, I want to introduce, of those who on the phone, and I see right here, excuse me, Alejo Rodriguez, I want to introduce. He is the Arts and Civic Engagement Coordinator at Exodus Transitional Community. He's also advisory board member for the Broadway Advocacy Coalition. He is also a fellow at the law school, the Columbia Law School. You guys are so wonderful, so don't even get upset with me if I'm fumbling over all these titles. Yeah, like, how could you list all of this? This is so much. This is beautiful, right? And Ivan as well. Ivan is on. He, amongst being a beautiful musician, a reentry specialist himself, he's standing in for Cedric Blackwell, who is calling in from Coxsackie Correctional Facility. Is he on? Great. So Cedric Blackwell is an artist and he's an advocate, and he's currently inside of Coxsackie, and we're going to hear from him soon, very soon, because we don't want to hold up his time. We are also, in that respect, waiting for Mr. Kenny Reams to call in. He'll call in on my phone, which is right here. Lord willing, we will have him on the line as well. And I just want to say all of this because look at how much is coming to the table for this conversation right now. This conversation needs to happen. This conversation is really going to change, narratives and shift directions and how people are advocated for and what policies are taken up and what are not, what is reformed, what is abolished. And we have a lot of abolitionists on the phone. So, saying the word reform on this forum is like, what? Get it out of here. It's always been bad. So we look forward to just digging deeper into that. But Jose, my first question is for you, my brother. How do you think this pandemic has informed and created a new urgency for clemency and early release? What does this tell us about what the federal, state, and local officials should be doing or should be moving on?
Well, first, let me just say quickly that RAPP, this thing was always urgent for RAPP because we was advocating, or our focus was on getting the elder people out of prison. Those who have already languished in prison for decades, sometimes 3 and 4 decades. And unfortunately, due to the conditions of prison and the substandard health that we are provided with, this has reduced the longevity of Black and Latinos incarcerated men and women to 58 years old. So that created a real sense of urgency because that is a real humane crisis. So, but with this pandemic, we became super urgent to get people out of prison because I knew from my personal experience that some of the men I left behind who were in their 60s and 70s with underlying health conditions, if they got infected by COVID-19, there was a likelihood that they were not going to survive. And in effect, it happened. Some of the men that I left behind, passed away due to a COVID infection. So, we shifted our focus from legislative initiatives to calling on Governor Cuomo to issue mass clemencies as the only solution to this crisis, to this health crisis that we felt was going to hit the New York State prisons very hard and wipe out an elder population that can safely be released with no concerns whatsoever. Unfortunately, the governor doesn't see it that way. He is, in essence, in my opinion, he was a prosecutor and remains a prosecutor. So his criteria for release is based on violence. How much violence was this person convicted of? And this is a very inhumane criteria to deal with a crisis. When we're dealing with this type of crisis, compassion of the heart should rule and not the crime of conviction. Now, the only thing that we think that the federal government, the state government, and local governments can really do to address a crisis that disproportionately impacts Black and Latinx people is to release them, decarcerate. Decarceration is the only real solution to minimize the impact of such a deadly crisis.
Thank you, Jose. Thank you, Jose. Ivan, is Cedric still on the phone?
Yes, he got about 30 seconds, maybe 60 seconds.
Tell ask him to tell us what we need to hear right now. I don't even want to read the question. Just tell him to talk to us. He only got 30 seconds left.
Talk to us, babe. You heard the questions I asked you, Cedric. Say what you're gonna say, brother.
Okay, very quickly before I have to hang up. But to answer the first question, there's only really one way to address public shifting the narrative with regard to public concerns, safety concerns. You have to release people. I mean, we're a data-centric population, and the numbers tell a bigger story. The fact of the matter is many men and women that come home, especially who are over the age of 50, don't recidivize, especially if they have an education. So the proof for the pudding is in the taste, not necessarily the pudding. You have to let people out, and that will help shift the narrative. I mean, we can only show you as opposed to tell you. And with regards to early release concerns or the other stuff, I wish I had more time, but I can't really delve into anything with it except for, I mean, you got, like the brother that spoke before, there are tons of people in here who are over 50, over 60, who are being faced with the fact of the matter of not when, not if and when they contract COVID-19. And the chances are that it's going to be fatal. They're not going to survive. And that doesn't have to be the case. You have to let people out of prison. Many men and women have changed their lives. They've made many changes. And they're ready to go to the street. They shouldn't be just sitting thus waiting to be hit by this insidious bullet that's going to eventually reach them. But listen, that's all. I have to go, and I apologize to the panel. I wish I could have stayed and said more, but I have to go. Thank you for inviting me to the panel. Thank you, Isaac. Thank you, Ivan. But I have to go. I love you, my brother. I love all of y'all. Stay positive stuff. Keep your mind up, and I'll talk to you soon.
Hey, Ivan, you heard a lot of that a lot more clearer than we all did. Can you sum up a lot of what he was just saying right now to us?
So basically what he was saying is he's pretty much echoing what Jose said, man. He's just saying that it's one thing to tell people that people have changed their lives and people don't threat to society. And it's another thing to allow people to show that. And he said by releasing people, you give people the opportunity to show what they can contribute to society, what the changes that they've made, as opposed to just telling folks. And there are folks that like Jose said, and that Cedric echoed, over the age of 50, over the age of 60, who don't pose any threat, man. And they're in the direct path, as Cedric said, of this insidious bullet, unnecessarily. Let them out. I mean, we understand, and we're not and he's not minimizing. And I don't think anybody in this panel is minimizing public safety or those concerns. Those things are always at the forefront. But if we're gonna pay any attention to the research and to the science that's been done, it shows clearly that folks in a certain age category age out of crime. They're less likely to recidivate, and they don't pose any or very little danger to public safety. So he had to pretty much rush that. And I'm sorry about that, guys. Kasaki, sometimes we get half an hour on the phone. Sometimes we get 60 seconds, depending on the officer that's on.
Ivan, man, there's no need to apologize. Thank you for summing that up. And I also to the change in the narrative and allowing folks to have the opportunity to show that they are not a threat to public safety. I think there's also, the topic that's not discussed in, how harmful prison actually is and what that does to a person, and what are we're working on something called post-traumatic prison disorder. Like, what is that post-traumatic stress that comes from prison? But I wanted to, my next question, I wanted to swing over to Rosalind. With your wisdom and with your experience with the criminal justice system, I wanted to pose a scenario to you and then ask you a question. So consider this an issue. People returning to society. Research shows evidence that incarceration has negative psychological effects on people in prison. These include dependence on institutional structure and contingencies, hypervigilance, interpersonal distrust and suspicion, emotional over-control, alienation, and psychological distancing, social withdrawal and isolation. These are all of some of what, some people have reported. Some of us hear those and we like, well, I know a few of those, I know one or two of those. I know about 3 or 4 of those. But when we think about you know, the impacts that incarceration has, what does it look like for the woman, the mother, the grandmother who is coming home from long-term incarceration, short or long-term incarceration? How do we support her? How do we be there for her? What is it that we don't know? School us, Roz.
Okay, so I just want to thank the panel for having me, first of all, and that's a mouthful. So I just want to state that many women who are incarcerated due to mental health issues, and some don't fit in that category of mental health, but they need psychological support for the trauma because they were neglected and not properly addressed from the start because of poverty, demographics, and race. The majority of incarcerated women have faced numerous forms of trauma, such as violence in the environment at home, sexual, physical, and emotional abuse, separation, incarceration of parents or relatives, and the list could go on and on, which in most cases led to their incarceration and maybe have been manifest as mental illness, substance abuse and use, and physical health issues. But once a woman is incarcerated, these issues are rarely addressed because of the stigma and fear of taking, being labeled the cuckoo or taking psychotropic drugs and being over medicated and walking around like a zombie in a prison. Women don't want that. So seeing a psychiatrist or a therapist, usually they shy away from it. And the fact is also that a lot of poor people don't even realize that something is wrong with them, and they don't have access and resources to mental health before coming to prison. So when they get in prison and they might exhibit signs of, stress and trauma, they don't seek it out. Although it can be obvious to tell in some cases that a person is suffering with some of the diagnoses that you mentioned, many refuse treatment because of the stigma around mental health. And that's something in our society that we need to clear up, that it's okay to get therapy. It's okay to seek help. It's okay to take care of yourself mentally. The saddest realization is that oftentimes the trauma is revisited and re-implemented once a woman is incarcerated. The cycle repeats itself and further damage is done, and our prisons are really ill-equipped to deal with these problems. There was a study in 1995 to 97 called Adverse Childhood Experience Study, or ACEs. And it was defined as potentially traumatic experiences that occur between the ages of 0 and 17. And it highlighted trauma and its effects. This was the first large-scale study to look at the relationship between 10 categories of adversary, which most women have experienced prior to incarceration. And these areas are physical, sexual, and emotional abuse, physical and emotional neglect, exposure to domestic violence, household substance abuse, mental illness, parental separation and divorce, and incarceration of household members. In childhood, and the health outcomes in adulthood that demonstrated as an association with health and social problems across someone's lifespan. You can Google ACEs and get more information. And also NPR.org has a practice test quiz that you can take to see if, most of us might fall into these categories. So re-entering society after incarceration is hard in itself. You need a place to live, you need a job, you need to support yourself, you got to get health insurance, ID cards, see doctors, parole officers, and attend mandated programs, substance abuse, therapy, etc. And most women, their main concern, they are primary caretakers of their households before coming to prison, and they resume this role upon reentry. About 3/4 of incarcerated women have children, and 2/3 of them are under the age of 18. And most prisons being situated so far from where the family is located, and visits are far and few because of lack of resources, many mothers' first concern is finding housing in order to have their families put back together. I only know of one program in New York that allows children and their mothers to live together upon release. And unfortunately, there are also mothers whose children are taken from them and they need lawyers to help them fight to get custody and visitation rights. So I really think, you know, the need for trauma-informed and resilient building practices in our communities, our schools, public health departments, social services, faith-based organizations, and the criminal justice system, prisons, jail, detention. And we need to enact some kind of legislature that acknowledges this trauma and addresses this. And it should involve the intersection of race and gender, with training for the groups that will serve individuals, programs, and education about how trauma manifests in the mind and body. We also need housing for women and their children coming home that will support these needs and support the family structure with gender responsive treatments and services. Women thrive in environments that will support them and encourage and emphasize their needs. And I just would suggest that we all advocate and educate ourselves about trauma, you know, institute programs and make them available in communities that women are coming home to. But I also want to emphasize the importance of prevention measures, and that before someone's incarcerated, they should have these resources in the communities that are most affected, in the marginalized Black and Brown communities. These resources aren't available to us, and we need these resources to help us heal and to help us to be better people, you know, and to address our issues. And like, you know, it's what's happening in the world now with what happened with George Floyd. And even though, you know, he is among thousands of Black men that have been murdered by the police, but our communities are not supported. You know, the money goes to other places. You know, we live in food deserts, and every corner is a liquor store, you know, when the white, more affluent communities, they have resources, they have after school care, they have programs for kids to go to, they have mental health. You know, I don't want to keep going on and on because I want to give everybody else a chance, but that's how I feel. We should set women up for success and not failure.
Amen. Amen to that. Amen to that, Roz. So I want to and I don't know how Alejo could possibly follow up Roz, but I'm going to sort of swing the same question your way, my brother. With dealing with everything she said with trauma and being preventative, you know, you work at Exodus, and Exodus is very much a good stamp in East Harlem, but also you guys are managing folks coming home from Rikers with as it relates to COVID-19. So what does it look like, you know, for men and in general, for people who are coming home from decades, short-term and long-term incarceration? You know, how do we support them? What do they need?
Well, first, thank you for having me on board. This is a great panel, great discussion, and I'm just happy to be a part of it. Secondly, just for a matter of the audience sake, because a lot of people here may know a little bit about Clemency already, right? But it's important for us to understand, to really lay out some of the steps. So like Clemency doesn't automatically get people released. So Clemency, all it does is in New York State, it may, and another thing too, we gotta realize this is going out across other states as well. People need to learn what the clemency policy is in their own state. So important. In New York State, where the person have a life sentence and they apply for clemency, all that does is give them the opportunity to go to the parole board earlier. So it's lenient, and it kind of like minimizes how much time you're gonna do. You can go to the parole board with less time, but even in that, there's no guarantee that you're going to be released. So I'm not saying that the RAPP campaign is like awful. I'm saying it's very important that we understand these steps, and that clemency is a way of getting out, right? That's a process, if you would, but it isn't a get out a jail free card just so you get clemency. So it's so important to delineate that, right? There could be other methods, right? Medical parole, The governor could pardon people. A pardon gets, if the governor pardons, that's an immediate release. So there are different methods, right? Clemency is just one of several. And to your question, so, upon release, one of the things that the sister Rosin was touching on, I have to just kind of like follow up on that, because, some of the question leads into, considering the impact of trauma that a person experiences while in prison. How is that going to help them in their transition, or what can we expect on the way out? And, the thing about it is, when you start itemizing what it was that creates that trauma, and you look at so-called communities of color, like that trauma has been there already in the community, right? Even before they get to prison. So you got communities dealing with community trauma, and then you send individuals to prison, and then you expect miraculously from being in prison where the trauma is compounded, you expect them miraculously to come out sane, whole, unaffected, right? There's no way in the world that can happen in and of itself, right? It requires some real clear attention, and it starts early on. It starts in the community as well as it does in the prison system. So we have individuals coming out and they're having problems with what I've noticed from people in the reentry world, as well in my own personal life, that the impacts that might be, or influences that might have been troubling for me in my reentry phase wasn't just because of my time in prison, right? I hate to say it, but I've been to some junior high schools that were just as dangerous as some medium correctional facilities upstate, right? Because they had guns, they had drugs, people were getting dropped, right? This is in the South Bronx. So, the violence level is such a severe thing. A lot of times that the trauma you're talking about is not just my prison experience, but a life experience. How do you deal with that, right? So we need to have a real good deep dive, right? Prison, or the prison experience is just one arm. It's just one arm of oppression that this country has had on people of color. There's so many other layers to that. And if we just turn around just focusing on one, we might forget the whole focus. Michelle Alexander has said in her book, there's a very small passage, and I really think we need to pay close attention to it. And she said, if we had truly begun to understand and learn from the era of civil rights, we would have never entered into the era of mass incarceration. In many respects, we looked at the era of civil rights and we're looking at segregation and integration as though that was going to fix everything. But there were so many other facets to the strategies of oppression. And don't forget, we live in a society that's okay. That is okay to categorize communities as being disadvantaged and marginalized. When you look at that, when the community is considered to be disadvantaged or marginalized outside of the margins of the rest of society, that in and of itself is telling you that these people are disassociated. And all those other ills that we're talking about that creates a lot of the social problems that we have in communities of color happens right there, and it's very much intentional, it's very targeted, it's discriminatory from its onset. And we've been hearing about this more and more lately because of the protests, but we know, the issues that are happening with George Floyd and all the other individuals that have been killed recently. This is not new. This is something that's been going on even before Eric Gardner, for Rodney King. It's been going on. It's just now being taped, it's being videotaped, and we can see it clearly. So this is intergenerational disenfranchisement. This is an intergenerational strategy to oppress people of color. And if we just focusing on one, and we need to focus in on the issues of mass incarceration, but we cannot focus in on just that, that we're blindsided to the reality that there's so many other things that need to be addressed too as well.
You know what, Alejo, I want to thank you for opening the door for this direction, because I'm going to swing the next question over to Jindu, and I'm going to expand it a little bit, just going off of what Alejo said, and just historical, trauma and just this generational oppression. Given the current climate of the uprisings and racial inequality, how do we make the clear connections between, I'm going to expand it to say, slavery, police brutality, and mass incarceration? How do we connect those together? Because a lot of folks are out, this is one thing I was mentioning to someone earlier. Folks are out there saying, so this is a very complicated thing, because within mass incarceration, if you understand the fight for that, you understand this is an abolition fight. We don't believe in incarceration, but I hear people in this fight for against police brutality say things like, well, they need to go to jail for the rest of their life. And while I do believe 1,000,000,000% in accountability, my heart still doesn't resonate with it, because I'm an abolitionist that doesn't believe that. So how do we make the clear connections of from slavery to police brutality to mass incarceration, so folks can see this clear line of oppression through and through? Sorry for going on.
No, it's a necessary context. I would say that we don't need to make those connections. Those connections exist, right? The system of mass incarceration, mass imprisonment that we have now is a direct kind of iteration, a direct mutation of the enslavement of Black bodies in this country. We can't overlook the legacy of things like chain gangs that emerged to kind of, recapture the workforce that was released when where enslaved people were free. We can't overlook things like the Black codes that were specifically targeting behaviors that Black communities engaged with, so that they could recapture the force, the work of formerly enslaved people, right? Like, our legacy of incarceration is one of racist policing. The hyper-criminalization of Blackness is one where we have been kind of conditioned to believe that Black skin is somehow associated with criminality, Black children are somehow predisposed towards criminality. The problem of incarceration is one where we have people that are inside right now working for pennies in the middle of a global pandemic in incredibly dangerous conditions, to produce things for major corporations, to produce things like hand sanitizer that they can't even use, right? Because we're so convinced of their inherent criminality that they can't even access things like hygienic resources and products. And so I think that we've seen, and we touched on this a little bit at the beginning when we were introducing ourselves, I'm an abolitionist, and we've seen an incredible amount of energy and necessary organizing, in the streets. People have taken to the streets and said, we don't want to see any more George Floyds. We don't want to see any more Ahmaud Arbery's. We don't want to see any more Tony McDade's. But, that context, that energy, this push to defund police, this push is an abolitionist push, right? We can't divorce that from its context. The people that originated and, really laid the path and did the work of creating our frameworks for defunding the police with the intention of dismantling the police were abolitionists and are abolitionists. So when we say, we don't want policing, we don't want prisons, right? The people that are saying we don't want police are the same people saying we don't want prisons. And that's because, we know the police don't keep us safe. We know racialized policing, class-based policing doesn't keep us safe. And, where do those people end up? In our prisons and in our jails, right? Like these people are filling our prisons and our jails. And there's this narrative of, and it's so insidious, this narrative of deserving that attaches to anyone who's involved in the system, right? That kind of keeps kind of some of our energy out here from reaching those people that are in prison, right? We see so much energy around get rid of the police. And I think it's because, and not as much energy around getting rid of prisons. And I think it's because we've been socialized to think if you're incarcerated, it's for a reason, right? If you're incarcerated, their system has somehow magically poofed and turned just for you, has delivered a just outcome just for you. And we need to really alleviate, illuminate that context for people. The struggle against racist policing, the struggle against policing full stop, is a struggle against imprisonment. There's no disconnect. There's no need to make that connection. The connection exists. Okay? The connection is already there. And so I think that we need to really honor the work of the abolitionists who've come before us and the people who are, working towards our freedom, our liberation now, and understand we can't have a system where we rely on, the hyper criminalization of Black, brown, and poor people, and we continue to prioritize punishment over safety, even in the midst of a global pandemic. We're wasting $80 billion a year to keep people from going home, to keep people in what has been described as, death traps, to keep people in situations where they're being, they're overcrowded, they're being threatened with solitary confinement if they're sick, they don't have access to resources, they don't have access to their families, they've kind of just been left behind. And so what really is on us, it's on us to really look to ourselves and, challenge every space that we're blessed to be in, challenge that narrative of deserving. Like, that's what this moment is about. This is abolitionist work. If you're not ready to do that work, maybe, do some political education and come back, don't leave. Do some political education and come back, but really understand that the struggles that we're facing now are the same struggles our ancestors faced, right? The work of abolition is not finished, because the work of abolition was not only to tear down the kind of institution of enslavement, but to build social institutions that will support the reentry of Black people into society to live whole, full, healthy, supported lives. And so that work continues. The struggle is just has a different face now, but we have to recognize it's the same work.
Yeah, thank you so much, Jindu, for saying that. I want to give Alejo a one-word follow-up, and we're going right over to David. David knew I was coming his way next. I feel like this was being lined up for him. Go ahead, Alejo.
Yeah, just real important, because when we talk about slavery, we're talking about, the brutalities and all that, and the background of police. Very important that we look at that. But it's also equally important that we don't forget about corporations and the role that politicians have in this. Like, slavery was an economic push, right? And you had corporations that was invested in it, and you had politicians that were advocating for certain practices to be done to keep people in that situation. So a lot of times we're focusing on the police, and we're forgetting about the individuals who write the laws and the individuals who are walking around with our money. We're buying from individuals who are literally still enslaving us, and that still happens today. We are still buying products from corporations and businesses that keep us locked down, that keeps mass incarceration going. And it's like we're fighting this war, and the devil walking away with the money, man. We're caught up in the controversy with each other, and the exploiters is walking away with the money, man. So it's so important that we also call that out to what it is.
Let me pull this over, Dave. I'm gonna pull this over to you with respects to everything that Jindu and Alejo just mentioned. I'm gonna ask you the second question I have for you, because that's right in line with what they're talking about. What is community justice, and what role do you feel it can play in shaping public safety, specifically regarding the racial disparities and the death penalty, and that particular point you pointed out to me about us seeing the face of racism through the death penalty in this country, but also during this moment of heightened national attention and awareness to the issues of racial justice. What do you want to see come out of this moment? And how do the change agents of the world take advantage of this moment? And we still got so much. This is like an ending sort of question, but we're going to ask it right in the middle, because there's so much more conversation we have, and we're going to keep this thing like building, because there's so much here.
So, okay, so listen, I want to thank you for being a part of this. I sit in an academic institution, and I'm here being schooled, and I really appreciate it. It really feels like a privilege to be part of this conversation. And I think, when we talked yesterday or whenever, the point I was making is that, when I give types, I want to anchor, I want to make sure that as we talk about abolition, that we don't forget about the death penalty. The death penalty is the apex of this penal system, and it's one that is one of the most definitive sources of social control over Black people and Black bodies that we have. And it's interesting, because when I talk about the death penalty, I often ask people, well, what do you think determines
you know, what determines whether we have a death penalty prosecution or conviction? And, you know, some very clever person will always say, well, race, of course, you know, and it seems like an easy answer in this country that most questions come back to race and somehow. And I say, well, what about race? And people say, well, Black people are charged and prosecuted. And it is true that there are disparities, but the fact is that the most telling feature is the race of the victim. If the victim is white, we're much more likely to have a prosecution for the death penalty. And from my perspective, you know, before Trayvon Martin and before others, you know, this told me that the nature of our society, the nature of our system is the system of political, economic, and social control in which white lives matter. And it's really important that that's the way the system has been set up, and that's the way it exists. So, you know, one of the questions about the death penalty that we started to think about is that the death penalty itself is an extremely expensive tool in that punitive toolkit. You know, it takes a lot of money to have a death penalty prosecution, and then the appeals, and then all the imprisonment. And so we wind up spending millions and millions of dollars, you know, to vindicate the rights of a small number of white victims, which isn't to say that we don't have to be attentive when people are killed, but at the same time, we've been doing that as a society. We've been denying and underinvesting in communities of color. We've written them off, as some of the brothers have said. You know, there's been a process, the process of mass incarceration is not just the policing. It's not just the imprisonment. It is, in fact, the way in which we have diminished, ignored, and denied membership to people who live in communities of color, right? And it's really important. So even as we spend all this money on the death penalty, we have not been spending it on our communities. And so at our institute, it raises this question of kind of what kind of society are we that chooses to allocate resources in this way? And you know, the fact is, as I said yesterday, I mean, that's a rhetorical question, because we know the answer is that's an unjust society. And in the United States, that's an unjust racist society, right? But there's another aspect of the question that's just all wrong. And the fact is that we aren't making these decisions. So that's one of the big lies that we have. It's right up there with we the people, you know, because we are not making those decisions. Those decisions are, and those ways of allocating funds are being made by people who don't look like us, who don't live with us, and who don't share any kind of understanding of the circumstances that we're thinking about. And so to me, the urgency has always been, how do we find a way to amplify our voices? And I don't subscribe to this notion that we are voiceless in any way. It's that our voices have been muted and not heard. It's like somebody pressed the mute button on one of these things when we talk. But what's happened is that we now know, that people on the streets and in our communities are coming together to start to think about, how do we create a different kind of policy framework? How do we create a policy framework that centers our voices and moves us forward in terms of what we think we need to make our communities safe and wholesome? So again, I mean, I'll finish. You know, I was going to set this up in a different way, but one of the things that I want us to think about, you know, all of us, is to think about what is justice, right? What does justice mean for us? And I will say, you know, I think for me, justice means being made whole. And this, you know, gets at some points I was going to make, that I'll make at a different point. But I want us to hold that thought, because we understand and know what we need to make ourselves whole. And it has to do with the kinds of communities to which, you know, we want to come home, right? And so, as the brother said, you know, there are things that we leave when we become incarcerated, and things we come home to, and sadly they're often the same things, and they're used to keep us inside at this particular moment in ways that are really, really harmful. So there are other things, but
No. I'm gonna try to set you up for all that, because I want to hear all of that you have to say. Elder, we coming your way, my brother. The question that I had for you was, within your work with juvenile lifers and homeless youth, what are the most common misbeliefs about people returning home from incarceration? And what is the correct narrative? What should we know that we don't know, especially when we're talking about juvenile lifers? and explain, like Alejo did, explain what this term juvenile lifer is for folks, because I'm looking in the chat and I see there's some folks in there who don't understand all of these terms that we're using.
That's a very important start off place, my brother. I'm sitting here biting at the bit because both Rosalind and Orlego said some things that were very essential to answering that particular question. First, let me start off by saying that in the latter part of the 90s, around the country, there was a big emphasis on putting juvenile delinquents into adult situations. They were given life without chance of parole. This is something that was not only in Michigan, but it seems to be regional. I say so because it took the Supreme Court of the United States to determine that the sentence of life without chance of parole was an unconstitutional sentence. It took it above and beyond what was given to be a fair and equitable sentence for whatever crimes that were committed. There were young men who were given life with no chance of parole for simply selling narcotics. So that balance went way out. But a couple of things. First and foremost, I want to deal with what Rosalind indicated, because a lot of times these young men and young women found themselves in that particular situation because they did have mental health concerns, and they were not criminal concerns, but mental health concerns that were not dealt with. And thus what ended up happening, you found kids like my own son, who was given a life with no chance of parole sentence, who's currently still serving that after 26 years. He had some emotional things, some mental things that were going on that went unchecked. There's a stigma attached to it. There's a stigma attached to juvenile delinquents, period. And that stigma led to a lot of scenarios that even now, coming home, they come home to situations that they're stigmatized. In my organization here in Michigan, called Retool, it's Youth Second Chance Aftercare, what we looked at is that recidivism in these particular instances happened because it went unchecked. Their situations that they left from went back. They learned some stability, they learned some discipline, and then they went back into the neighborhoods where they came from, and those scenarios that caused it in the first place were still there. We attached it to now my brother, you're clergy, and I was clergy at the time when I started Retool, and we attached the only institution in the Black community we have, the church, to the responsibility of giving some kind of relief to these young people because they're stigmatized. They are devalued. In the training and Retool, what we said is, listen, you've got to have some kind of way to reach these young people. And in doing so, a lot of the stigmatism that we're looking at now was eradicated. Listening to a lot of what I'm listening to now about abolition and things of that nature allows only one thing to happen. That is to escape the responsibility that we as a people have, and specifically the only institution we have, the church, from actually interceding in these situations and giving an opportunity for alternative behavior, alternative solutions to what the community as a whole isn't doing. When is the last time you heard a Jewish person beat down in the street? When is the last time you heard a Middle Eastern person beat down in the street? It doesn't happen because they've got the representation of that institution of belief systems that would not allow that to happen. But we don't have it. We haven't utilized it to the fullest. So yes, we can actually mandate. Listen, Brother Lego mentioned the fact that there are people who are taking the monies that we're taking and and continuing their oppression. The Pepsi-Cola company ended up buying a gym floor for the institution I worked at. And you got to understand that they didn't buy that floor because they wanted to be model people. They were given an opportunity to make certain that there were people that constantly took care of those beds. That corporation tie-in is a very real one that the brother talked about. It's very real. But again, the institution of the church, the other institutions we have, will take this hopelessness that these young men are coming back to and give them another opportunity. It gives them an opportunity to recognize that they can be positive contributors to their communities. We can go on and on about that, my brother.
No, I'm sorry. I just wanted to make sure I don't want to cut nobody up. I appreciate everything you said right there. I want to swing this question over, swing my next question over to Jason. How you doing over there, Jason? Sorry for making you wait so long. I hope you've enjoyed everything you've been hearing, and it's just been so informative for me. I know that much.
That's been great.
So from your perspective as a trustee for the Association of the Legal Aid, and some of your work in writing on defunding the police, what does the campaign for defunding the NYPD mean in New York City, and what are some of the budget priorities you'd like to see?
Thank you. It's a real honor to be able to share this space with all these incredible panelists and people doing really great work. I echo everything that's been said already, and some of what I've heard, you know, it's about identifying the issues within the system and looking beyond just individual kind of problems or issues or interpersonal kind of conflicts that people may have individually with a police officer, right? These are broader systems, and there's a history and a context that has set it up so that the system of policing in prisons and incarceration is doing exactly what it's designed to do, which is to marginalize and oppress Black people in this country. And so if that is the starting point of the conversation, then we're not talking just about bad apples, which is oftentimes what we hear in the media, that it's just an issue with individual bad cops, but really the system's working great and that it's, you know, it's keeping people safe. But if we understand that the Black Lives Matter movement is about a system of police violence and policing and incarceration, then we also have to understand that abolition really is the vision and the solution to the problem. And so I think that that's an important framing, because so often people get caught up in the idea of, okay, well, what about police reform? What about like these things that tangibly they feel like can be achieved or that could improve the situation of policing in America? And it's not to say that reform wouldn't have any impact at all. Maybe it would. But at the same time, as some of my co-panelists have indicated, reforms have been made over generations, right? There's a movement now for body cameras and all of this other stuff, but it's only just capturing what has always existed in America. It's not actually eradicating police violence. We just have it caught on video now. And not even all the time, right? Because we also have officers who cover the camera, who video footage disappears or it's not released to the public. And so we have to think bigger and we have to demand more. And I think the defund the police campaign, which has different interpretations depending on who you're asking, but in the abolitionist sense of it, which is to, as Mariam Kaba said, it is to abolish the police. That is the demand. That is not, I think it's important for people to understand, this is not a theoretical argument. This is not an abstract, you know, pie in the sky vision, that this is rooted in something that we can actually do. And so if we understand that policing and mass incarceration is a system that we built, then we can also understand it's something we can dismantle. And so in the context of what's happening in New York City, which is also happening in cities and states all across the country. There's been both a drop in tax revenue because of the coronavirus pandemic, but also the Black Lives Matter uprising has highlighted the need to take away power that the police has and that has been overinvested in, right? And so these two things coupled together, Black Lives Matter and the issues around the decrease in tax revenue has brought us to a point where the conversation around defunding the police is actually actualizable. So this is something this is a conversation I don't think we could have had even a couple of years ago. And I think it speaks to the power of the Black Lives Matter movement, the generations of struggle that Black people have led and fought for. The current defund campaign didn't happen overnight, right? And so when Chindu was talking about abolition, you know, this is the work of Angela Davis, this is the work of Critical Resistance, this is the work of so many of my colleagues on this panel who have been doing this work for decades, right? And so the defund campaign is about cutting police funding, right? And so it's about decreasing the police force. It's about abolishing the police, which, you know, realistically in New York City, I will say, you know, that's probably not going to happen this budget cycle, but there is an actual conversation about defunding the police by $1 billion. And that is something that we're hearing multiple council members and other elected officials saying, which is something they would not have said before. And I want to just underscore that part of the argument around defunding the police isn't just, you know, we have an issue with the police, but it's about reallocation of funding. It's about investing in community. And so when we heard Rosalind talking about the issues of trauma in our communities, the issue of trauma that that the environment creates and inflicts upon Black people and marginalized communities and intersectional experiences of Black women and trans people of color, this is what we're talking about, right? This is about an environment that creates trauma that we also could address by investing in communities, in a way that creates real public safety, right? Public safety is not realized when you send the police to arrest and harass and kill homeless people. That does not put homeless people into a home. That does not create public safety. Public safety is about housing. It's about economic opportunity. It's about jobs. It's about education. It's about healthcare. And both in New York State and in New York City, we're seeing cuts or proposed cuts to healthcare, to housing, to education, to social services. And so the defund campaign is about flipping that. So it's not only it's about defunding the police, but it's also about investing in communities. And so I think I'll stop there.
Thank you, Jason. I appreciate every single bit of that. So for the second round of questions, I'm just going to ask all of the panelists. First, I want to just thank y'all for all the information and the wisdom you've already put out. There's so much like feedback coming in through the chat, and folks are definitely engaging, and folks are on point. They're snapping fingers, they're thinking, and this is what we want. We want to get people active, right? I want to come back to Roz and Jose, but I want to ask you, Roz, to tell us a little bit about VDAY, and then for anyone who's watching this or is concerned about protecting the lives of those who are currently incarcerated and public health for everyone, what should individuals do to take action?
Oh, I'm on. You can hear me?
Yes.
Okay, so VDAY was started by the playwright Eve Ensler in 1994. She started with the play The Vagina Monologues. I don't know if anybody's ever heard of that, but it she did interviews with women that were abused and raped, and she created a play about it. And because a lot of times we don't want to talk about our sexuality, or as women, we don't want to talk about our vaginas. And this is what she brought to light, you know, how women felt about their bodies and their vaginas and being raped, and how war is one of the tools they use in war is raping our women. And it took off into become a global organization that vows to end violence against women and girls, transgender, cis, and those who hold fluid identities. She has she had concentrated in the Congo because of the wars that were going on there, and created a safe house for women there that is still going to this day. It's run by somebody on in our staff, and it empowers women. It gives women back power that was taken from them through rape and through abuse and through, you know, all the things that happen in war and in Black and brown communities. We have 4 core beliefs, and that art has the power to transform thinking and inspire people to act. That lasting social and cultural change is spread by ordinary people doing extraordinary things, like everybody on this panel. Local women best know what communities need and can become unstoppable leaders. You know, part of what our core belief is to empower women to get into the communities, become activists, do what you know your community needs, provide these resources and work in your community. And I think that's like what we need now. You know, we need the grassroots people to get out there and to do what is necessary. We can't keep just saying, we want this, we need this. We have to be that change. And the last one is that one must look at the intersection of race, class, and gender to understand violence against women and in our society. So those are the things that we strive for in our work.
Okay, and tell us real quick, for anybody listening, what should someone do to take action if they want to be a part of the work VDAY is doing, if they have experienced, you know, the same things that other people have experienced? This is a take action round. We want to express some things, and then what should folks do? We need to give people some walking papers.
So people can go to our website, vday.org. It's a host of things that you could get involved in. But I would say on a smaller level, like I had just mentioned, that get involved in your local communities. Understand who your faith-based people are. Talk to them about mass incarceration. Ask them to start a group, you know, for women or men. You know, get them involved to understand. Like the thing that made me so angry is that I didn't know my history, and I'm learning my history now that I came home. I didn't know my history. I didn't know about the oppression of my ancestors and how the intersectionality of it just ran rampant. I didn't understand it, and I'm learning now, and we need to educate ourselves. We need to understand our history so that we can move forward. And we need to have our communities involved in it. Just like, you know, a lot of white people were saying, oh, you know, well, I was feeling for the Black people until they started looting. And it's like, really? This man was murdered, and you're going to say because somebody was looting that you don't care about him being murdered? You know, we need to educate people. We need to educate our white community about what this epidemic of mass incarceration and slavery has done to our communities. And we need to heal. And it's not about hating white people. It's about us coming together. You know, it's about coming together and trying to figure out what's best for us and how we can rise above this. You know, it's not going to be a perfect world. It's never going to be a perfect world, but we can make things better for them. I might not see it in my day, but for my kids and my grandkids, you know, to make this place a better world, and to end mass incarceration, because it's gone on too long. We have to abolish it. That's all I have to say.
Thank you so much, Roz. I appreciate you so much. Jose, I got a question for you, my brother. Oftentimes when we discuss early release, we hear concerns about public safety. We're going to just revisit this because we want to hit this home. You know, what do you know or have you experienced that addresses this concern? And what is this concern? Why is this concern so misguided when we start to use this narrative of public safety as a deterrent for letting people go home?
Well, first of all, let me just say that phrase "public safety" is just a fear-mongering phrase. But I quickly want to backtrack just a little bit to say that, you know, what people should do. People should learn to empower themselves and to study the history, the real history of slavery, so that we know exactly what was done. And another history that we really, really need to study the history of capitalism. And let me go back to because you know those two histories will empower us to make right decisions in moving forward. Now, the PBA, Special Interest Groups, the Police Benevolent Association, they use these phrases to control the decision-making process of the New York State Parole Board. They're supposed to be an independent body, but they're not. The governor controls their decision-making process. The PBA wants to also control their decision-making process. When they tell a person who's from Central America, South America somewhere, a guy's from Bolivia, they tell them that to release you at this time would be a risk to public safety. Now, what public safety are we really talking about? So it's just a catchphrase that they use to deny people parole, perpetual denial, and in a lot of cases, that perpetual denial leads to a person either taking his own life or dying of a disease that could have been treatable had he been released in the streets. So these catchphrases are things that we have to, and I hate to use this word reform because I'm not a reformist. I've languished in prison for close to 4 decades. I know that there is no such thing as a good prison. If anybody knows, we know. And I know that prisons only serve one single purpose. Prisons are created to create prisons, or to create the need for prisons. That's the only purposes they serve. They don't rehabilitate. We rehabilitate ourselves, or we empower ourselves by our own strength and will. But these public safety is a term that I really use. I like to use community safety.
Mm.
We when we are released, those of us like Alejo, Ivan, me, and dozens of others, the sisters like Ross, you know, when we are released, we enhance community safety. We are not a threat to our own communities because we are the only ones who was going out and reaching these kids who, for the most part, have been abandoned by society. You know, and society blames them for their behavior instead of blaming themselves for creating the conditions that forces these kids to go in a route that they go to. But we enhance public safety, and that has to be clearly understood because no one else is going to do the job that we're doing because we know that they have destroyed an entire generation during the time that we were incarcerated. And we're not going to get that generation back. So we are the ones that has to be involved. Every formerly incarcerated person, this is what I tell them, you have to be involved in restoring and healing our communities and empowering our communities because in the end, mass incarceration didn't start with the drug wars. Mass incarceration started to control our communities, to marginalize our communities, to imprison our leaders and imprison the communities that supported that leadership. And we're talking about the Black Panther Party, the Young Lords Party from Spanish Harlem, which I was a part of. This mass incarceration was designed to imprison that leadership and those who followed that leadership.
Thank you, Jose. I want to swing this over to you, Elder, just in light and in the same token with this lens of public safety, taking it over to how this impacts, you know, the people who experience incarceration. Can you describe the levels of hopelessness you've seen in the lives of some of the men you've worked with who've experienced incarceration, and what were some of the biggest challenges they faced? You know, because that question comes from, like, while on one end there's these narratives saying people are this, there's another front where people are going through this. You know, so what were some of the biggest challenges you've seen people face? You with me, Elder? Are you with us? Okay. Okay.
I'm back. One of the things that I'm kind of impressed about is what Jose said. There are people who are coming back who are problem solvers, who are community organizers, because where they've been and what they've actually done, yourself and the brothers that I'm listening to, they're actually being able to do the kinds of things that are necessary. But many of the brothers that are coming back, I've witnessed, have had very difficult times understanding where they fit in, because there's not going to be a massive acceptance of where they've been. There's a devaluation of their experiences. There's a devaluation of what they bring to the table. I indicated to you a little bit earlier, and I've been out. Technology in and of itself can be a challenge. Imagine a brother who's been away for some time, and now he's got to learn how to exist in a society that doesn't embrace him. We found that even on social levels, many of the brothers who have come back really have no idea, just even on an interpersonal basis, how to get along with the opposite sex. Generally, I've heard it time and time again in counseling scenarios, brother, I don't even know how to speak to people anymore. They tell us we got to come back changed, but then we come back changed and they're looking for the roughnecks. So it's a very difficult scenario. When my son comes back home, I recognize the fact that with him being in there right now, and brothers who are being imprisoned right now, no matter what their sentence was, there's a strong possibility that it's a death sentence. And with that being the case, when these brothers do come out, they come out wounded, they come out incomplete, unwhole, because they've been sick. They've been allowed to grow sicker on the inside. What do? They're not going to be embraced by the society as a whole. This is why I maintain that those institutions that do exist, the church, educational scenarios, forums like what you do, are necessary to create value to these brothers and sisters.
Thank you, Elder. I think Jindu, I'm gonna swap you real quick with Dave, because I think this goes to what this reminds me of the conversation that I was having with Dave. And I wanted to ask this question related to the language that we use in reentry. And you spoke to me about not, preferring the word reentry, nor did you prefer the word returning citizens. And my question is, well, what role does language and labeling play in mobilizing change, specifically for people returning home? And give us your wisdom within, the language and the accepting of people. And we keep hearing a lot of wholeness and healing. So just wanted to hear a little bit from you.
Oh, well, thank you. And I'll try to be quick. I know reentry is a term of trade. My basic point is I think I want us to rethink the terms we use, and I want us to use terms that we own and that reflect what we're talking about. If we listen closely today, we heard people talking about coming home, not about reentering, right? And so to me, in terms of our work, look, in terms of the history, we live in a country that's defined by a founding lie. That founding lie is we the people. We the people has never included us. There is no we the people, right? So one of the things that I want us to think about is this question of reentry is a trick we play to make it seem like people were once welcome members of society, people that we embraced, that we thought well of, who and then something happened and they went away and now we're going to let them come back. Well, no, the fact is that many of us who wind up incarcerated in cages were excluded from membership from the get-go, right? We weren't members of the society, and to kind of pretend that we've gone off and done some time and we're going to come back and we're going to be accepted as members of society is a lie. Right? That's the first thing. I think that's really important. And it's provocative, I know, but so at our institute, we don't talk about reentry. We talk about pathways home. And so when I hear, brothers talking, and when I hear people talking about coming home, that's what the experience is, and that's what we want to be able to do. And we want to think about communities of embrace and kind of what are the mechanisms for that return. And there's a related phrase that we also choose not to use, and that is this notion of criminal justice. The criminal justice itself is a term that conjures and connotes and denotes and triggers an association between Blackness and criminality. And every time we use that term, I think we're triggering that association, and we need to get away from it. It's a received term. It's not our term, right? So when I said earlier, when I thinking about what justice means, to me, justice means being made whole, right? It's a different thing. So again, we don't talk about criminal justice on our website. We talk about safety and healing, because the notion of being made whole is something that applies both to our communities and to us as individuals. And it has to do with thinking about, it leads us in a different direction from the punitive policies that the nation embraces, to thinking about, as Sister Roz says, kind of how do we define for ourselves what we want to do and how do we act on that? And so my point, is really, I think, that the language we need to create our own language and our own terms of engagement with the society, and then act on those terms. So, and again, on this question of public safety, I couldn't agree more. Public safety itself is a term of control, right? Public safety is associated with controlling us. Safety and healing it has to do with us defining for ourselves what we want, what we need, and what will make us whole. And finally, I will say, I want us to think about the way our society is a society that thinks about, we often talk, and especially in this moment where we're getting close to a real conversation about race, where the difference between people of color and whites is that, there's a door here, and white people, that door is wide open, they never have to see it, and for us it's closed and we have to bang on it. And so our policies are in that framework, in that analogy, are designed, well, let's open the door a little wider, let's let a few more people in, right? And what's wrong with that, and the brother who talked about capitalism, the problem is the wall, it's not the door, right? The problem is that there's a wall there that has a door in it that lets a very few people in, and our responsibility, and as we think about what we're doing, what we need to do is think about how we tear down that wall. And this idea of scarcity and limited access, we're gonna let a few more people through the door, is what leads to the kind of separation that keeps us from hitting that goal.
Thank you so much, Dave. Jindu, my question to you is, in your opinion, what are the greatest, just with all of the information that all the research you've already done on the virus, everything that's been said here, and just based on what you already know in your own legal expertise, in your opinion, what are the greatest legal barriers to protecting the lives of those who are incarcerated during this pandemic? What racially targeted laws do we need to see reformed and or abolished to protect the lives of these people?
Yeah, I think that's an incredible question, but I wouldn't specify laws, right? I would specify the whole system. We need to abolish the entire system that relies on carceral mentalities, carceral institutions, carceral practices, and carceral tools. Because before COVID-19 hit, prisons and jails and detention centers were already in crisis. Long after COVID-19 is gone, those centers will still be in crisis. So the best way that we can advocate for those folks, the best institutions that we could tear down, the best laws that we can challenge are the laws and the mentalities that uphold this idea of incarceration as any sort of legitimate exercise in a free and a democratic and a whole and healed and just society. But that's our long-term goal. So having that sort of framework and long-term goal is important. But on a shorter term, in a kind of like more intermediate level, we've seen approximately 90,000 people have come home since COVID-19 has hit, have been released from either prisons, jails, and detention centers since the virus has hit. But this is a drop in the bucket when you consider the fact that 2.3 million people are incarcerated, and 40% of them are our people, right? Our Black people. So this is, there are all of these kind of procedural stopgaps that have been applied to limit the release. The little political will that we have to let people come home has been further kind of chopped up and squandered when you think about the fact that jurisdictions are saying, okay, we're going to release people, and then they kind of erect these barriers. We're only going to release the most vulnerable. We're only going to release the nonviolent people, the people in here for drug offenses. We're only going to release, people in these very minute categories. And then even on top of that, are erecting these barriers that then they themselves are using as challenges to why they can't release people. So 3 things that I've seen are, and they're all contingent on the use of electronic monitoring, but we've seen jurisdictions like Cook County come under fire for saying, okay, we have people in our jails who are eligible to go home, especially in the midst of a global pandemic. They need to be home, but we don't want to release them. They're eligible for release, but we don't want to release them unless they have electronic monitors. And we only have so many monitors, so we can only release so many people. So they're kind of creating this barrier for themselves and then saying that they can't meet it, right? People who are eligible to come home, who have already been deemed, not a public safety risk, are then being limited, being denied their release because the system is saying, well, we don't want to release you. We want to have a hold on you. We want to put this monitor on you, but we don't have the resources to do that. And so we're going to punish you by keeping you incarcerated. Something else that we've seen, which is completely absurd, and that was absurd as well, but people saying, we have people eligible for release, but we're not going to release you unless you can pay for the monitoring. And if you can't pay for the monitoring, you're going to sit in this jail cell. You're going to sit in this prison cell. And the fact that people think that that's okay in any way permissible is really haunting, right? We have people who are panicking, whose families are panicking because they need them to come home. And they're sitting in these essentially COVID-19 death traps because they don't have the financial resources to afford these sort of electronic restraints. A third thing that we've seen is jurisdictions limiting release by saying, we have people eligible for release, but we don't think that we should release you because you don't have a stable home. And that goes to so many problematic things with the system, because we know that system impacted people are 10 times more likely to be, unhoused than the general population. And we know that that's, compounded for Black women and men and Black people, gender nonconforming folks. So that burden falls on us. And we also know that the majority of women who are incarcerated are survivors of abuse. And a facet of abuse is financial dependence on the person who caused you harm. And a part of that is housing dependence on the person that causes you harm. So a lot of those folks are, unreliably housed and facing kind of homelessness and being unhoused. And so, when they either act against the person causing them harm or, try to leave the situation and end up on the streets, they're criminalized again for, offenses of survival and then funneled into a system. And it's nothing less than a slap in the face to have that same system on the back end say, well, we know that we should release you, but we're not going to release you because of how all the systemic inequities that informed you being in our prison, in our jail right now. So those are 3 kind of things that I've identified that, folks have been thinking about who've been doing this much longer than I have. But also, like, solitary confinement is a huge thing right now, right? We need to end the use of solitary confinement. As of right now, over 300,000 people are being held in either solitary or group confinement because of COVID-19, right? They're using what has been determined by the United Nations as an instrument of torture to kind of medically treat COVID-19 in prisons and in jails. Instead of letting people go home, they're like, we're just going to use this punitive device and do the best thing that we can for you, which is just kind of re-traumatizing you instead of letting you go home. We need to get rid of that and let people, kind of escape the negative effects, the mental effects, the physical effects of being held in solitary confinement for such a long time, because a lot of these folks have been held since March. And we also need to end the death penalty. There's no reason that we should, there was all this language around, we need to cut off everything that's not essential. And, in the midst of COVID-19, we don't need to have people on death row. We don't need to have people in prison, period. But we also, like, people who are on death row experience incredible mental anguish associated with that sort of impending threat of the kind of planned, cold, callous end of their lives. They don't need to have that threat and that sort of mental anguish compounded with the mental anguish of being incarcerated in the midst of a global pandemic. So those are some things that I've been kicking around, but the overarching framework is abolish all forms of incarceration and detention.
Thank you. Abolition, it gotta go, no reform. Jason, Tell us about that digital campaign you working on, Cops Live.
Okay, so 3 quick things, and then I'll include Cops Live as the third piece of it. So I want to underscore what Chindu just said. I won't get into repeat all the campaigns, but let your elected officials know. So it's not just that we're having conversations with each other, but we're making a demand. We've identified who the stakeholders are, and we're presenting that demand to them. So I think that's really important. Let your elected officials know. The second piece is about redefining the narrative. And so we've talked a little bit about this already. So when we hear about the criticism of protesters looting, I think we need to reframe that discussion, right? Because Black and brown communities have been looted by white supremacy for generations. It starts with land theft, it's about slavery, and it continues even now with various forms of economic and material exploitation that our communities are experiencing. And so we need to redefine the narrative. We need to redefine the narrative on looting. We need to redefine the narrative on public safety. There was no public safety for Breonna Taylor, who was killed in her own home. There was no public safety for Deborah Danner. There was no public safety for Eleanor Bumpers. There was no public safety for Akai Gurley. These are all people who have been killed in their own homes by police, and that's only scratching the surface of the names of Black people who have been killed by police violence in their home. So we have to redefine the narrative. We need to, because I think oftentimes we're having conversations with people where they've set the baselines of what that conversation looks like. And so they talk about danger and public safety and threat. And that narrative relies on anti-Black racism. And they expect us in having that conversation to be primed to kind of regurgitate those narratives that we've heard. And so we need to redefine the baselines for that conversation. So when we're talking about pathology, it's not about pathologizing Black and brown communities. It's about the systems and an environment that has created harms in our communities, that have created trauma, that has created disinvestment. And also that policing is actually harm. Policing is the threat. And like I said earlier with the examples of Breonna Taylor, we need to redefine that conversation around public safety. So the third piece of it is a concrete digital action that we're taking tomorrow, Friday at noon. This is something that I'm co-organizing with my colleagues, the Black Attorneys of Legal Aid. We're part of the attorney union here in New York City. And the basic premise behind it is cops lie. They lie all the time. They lied about Shake Shack poisoning them. They lie and plant evidence on Black and brown people. They lie about unconstitutional stop and frisk. They lie about fearing for their lives so they can kill Black people with impunity. And so this action is tied to redefining the narrative. And it's something that, public defenders all across the country are going to take part in together. We're going to inundate social media with our stories of police lying. And also, this is something anyone can participate in. It's not just for the lawyers, it's not just for the public defenders. If you have your own stories, if you have your own examples, or if you want to share other news clippings and articles that you've heard about, because there's been New York Times pieces on police lying. There was a piece called Test the Lying. But if you ask anyone, most people have never heard of that. Most people have never heard that. New York Times actually did a huge piece on this last year. And so these are narratives that do exist out there. I think David made that point earlier, that we've been saying this stuff, but we've been put on mute. And so it's time to take us off of mute and collectively raise our voices around this. We redefine the narrative. And also this is part of a broader series of actions that are happening in New York City around the Defund the Police campaign, but it's also something that we're seeing nationally. So if you want to participate, you can use the hashtag CopsLie. There's a Facebook event with more information. It's also posted on both my Twitter handle, Critical Race, and it's also posted on our Black Attorneys Legal Aid Twitter handle as well. Thank you.
Thank you so much. So we're just over 7 minutes over our 6:30 mark. We did have one question from the audience, and if anybody needs to leave, I just want to say thank you for staying on for so long. But if anyone wants to wrestle with this last question, I think it's a great one, and I would love to hear Jose, your perspective as the director of RAPP, but then other folks as well. Someone has a question of what advocacy methods do you recommend to link the carceral system to the movement for Black lives?
We're actually making that linkage on June the 3rd, June 30th. Rosalind Smith will be there with the other RAPP leaders of the campaign. And this is called Incarcerated Black Lives Matter. And because the murder and brutality of incarcerated men and women in New York State prisons mirror the murder and brutality of Black people in our communities. And this has been hidden from public view. There are no cell phones in prison to capture this brutality. There are no cell phones in the women's prisons to capture the brutality they face on a daily basis. This is a nightmare that we live for years and decades. So join us in this webinar. Again, it's Incarcerated Black Lives, a community education webinar. June the 3rd to June the 30th, 2020. That's one way to get involved. Another way is to visit our website. Look at all the events that we have coming, as well as look at our newsletter, read our newsletter. It's an educational process here. So, unfortunately, we would invite you to a rally in Albany, but they shut down Albany. They took one tool or one educating and organizing tool that we effectively used for years, and that's rallies and protests. But we can still do that virtually. And hopefully we can do small rallies with social distancing and facial covers.
Thank you, Jose. Does anybody else want to tackle that question? What methods can do you all recommend to link the carceral system to the movement for Black lives? Anything specific? There's folks on the ground who have the energy to move in a lot of ways and now are educated on these links. So any methods for them? Anybody got anything?
I just think what Jose was saying, look up an organization. RAPP is a wonderful organization. Get involved. If you're going out to protest, get a mic and speak about it. Educate. That's what we need to do. We need to educate people. There's a lot of information out there now, after everything that's happened and the movement is in full swing and ignited again. Is loads of information out there. We have to, my biggest thing is that we can't depend on anybody else to do it. We have to do it ourselves. So you have to do the work. You have to put in the work if we are going to change anything. So get on the website, ask people that look up stuff, and get out there, and more power to the people. Do what we got to do.
That's right.
I wanted to say something too that I wanted to share before we go off, and it's a quote from Angela Davis, and it is she talked about prisons relieve us of the responsibility of seriously engaging with the problems of our society, especially those produced by racism and increasingly global capitalism. And we really need to really think about that. That's something, that I just want to leave everybody with. So thank you.
Roz, thank you so much for that final word. We're going to end it right there, everyone. Please do visit RAPP online. Please visit their social media sites so you can learn how to do more, engage more in this process, how you can just be educated on how to perhaps write, a petition, a letter, whatever it is. You may see change in a specific place, and that's where you want to go. So educate yourself by looking into organizations like RAPP. Check out the Confined Arts. We're doing a lot of art and advocacy. We're doing a lot of research on changing the narrative. Research that will be changing the narrative, We're doing a lot of research in the areas of post-traumatic stress, language, and just really unpacking and going deeper, because the full story is not being told. But I'm so appreciative of this moment because people are listening. So with that, I just want to say thank you to all of our speakers. Could we just snap it up, clap it up for them real quick? Please. You guys were amazing. I'm underqualified for jobs like this, so I love when they give them to me. I love you all very, very much.
I'm back at you, man. Thank you so much.
Thank you.
Honestly.
You guys are great. All right, everybody. Blessings. We're gonna.
Been an honor.
Okay.
Thank you all.